Oh, okay. All right, guys, those of you who don't know me, my name is Dr. Drury. This is Dr. Mulvihill and Judy. Uh, Thank you guys for coming out. The reason we have these classes are several reasons. For one, this primarily because this has made such an impact in my life and Dr. Mulvihill's life. It's changed our lives in the directions we were going that it's not fair to you guys for you to come in and just get checked, get adjusted, walk out of here feeling better, and then that's it, okay? Because there's a lot more to what we do than just symptomatic relief. This is a way of life for us and for our families and for many of our patients. You'll see if you've been around here for a while, we have some people that have been coming here. I have patients that have been coming to me for 10 years since we've been in practice. Still just come every now and then just to stay in shape because it's a whole lot easier to stay well than to get well. So I want to start off, I want to tell you a little bit of a story just to kind of get you in tune with where we're going here. When I first got into this upper cervical work, I was so dedicated to it that I got really involved with the organization in teaching new doctors, teaching students, teaching medical doctors. We traveled all over the world, literally, to Russia, to St. Louis, Florida, New York, Dallas, Alabama. We were going somewhere all the time, and we were either teaching somebody, some organization, or we were doing some sort of research to further our learning in the upper cervical area. Well, anyway, one day I was finishing up from work, kind of like this, was a real hectic day, was just slammed, and I just, was running out the door trying to get to the airport in time because I had to fly down to Dallas. We were doing a seminar at Parker College down there. So on my way down, didn't have time to eat anything, kind of grabbing a snack. So what I did was I flew into the airport in my car, drove into the airport. And still hungry, so on my way trying to get to the plane, there used to be, I don't know if there still is, there's a Mrs. Fields, is that what's called Mrs. Fields? A cookie-like place, So I went through there and, just went in and said, give me, one of everything, whatever, several different cookies. Put them in my bag, got on the plane, ready to take off. Well, I'm sitting there, and all my family's in Kentucky. So this little old lady comes walking down the aisle. And when I looked up at her, I was like, a little sweet little lady. She just kind of reminded me of my grandmother back in Kentucky. Well, she came in, and so it turned out that she was actually sitting right next to me on the window seat. So I light up, and said, excuse me, honey, and she eased in and sat down, And so anyway, before she had gotten there, I had my cookies in the bag, and I just set them down kind of between the seats in the little opening there. Well, we get on the plane, or the plane decides finally to take off. We're up in there, we're cruising around, so finally I start to get a little bit hungry. Well, look down, I'm thinking, it's about time, so I reach in and grab a cookie. Start eating it, and out of the corner of my eye, I see this little lady look down at my bag and reach in and grab one of my cookies and started eating it. And so I'm thinking, okay, at first I was thinking, okay, this lady's a little crazy, something wrong. So we go a little further, and get a little bit further, start to get those hunger pangs again, so I reached down to get another cookie. I know I didn't have my hand out of the bag before she already had her hand in there, okay? Took my last cookie. And I'm looking over at her like, you crazy old bag. Here I was comparing you to my grandmother, okay? Thinking this little crazy old lady, So finally, it was one of those deals where we pulled into Atlanta, and some people got off the plane, some people got on the plane, and then the same plane went on to Dallas. You've been there. Flight attendant. So, I was kind of hanging out on the plane, for a little while. The lady, we pulled up anyway. The lady got off the plane, and I'm, so get out of here. So she left. So we go on, flying to Dallas. Well, about the time we're coming down, when everybody says, stay in your seat, I'm wrestling around trying to get my briefcase together and stuff, so I can be the first one to the door. No, I'm kidding. But so I reached down underneath the seat to try to get my briefcase. So I was, get ready to get off the plane. What do you think I found?
Your bag of cookies.
Found my bag of cookies.
Oh my goodness! Oh no!
I had been eating her cookies.
Oh no!
It just so happened she had the same idea I did. But I'm figuring what happened was when she sat down, maybe it separated the seats enough to where my cookies fell through. And she had the same idea, just set her cookies there between the seats. So I was eating her cookies all along. So the point of my story is that sometimes when you absolutely, positively sure you know exactly what's going on, don't always be so sure, okay? So some of the things we're going to tell you about today is going to be a little different from what you've heard probably your whole life. Okay, it's going to be a little bit on another spectrum. But everything I've got, I promise you, I've got the research. Okay, I don't just put this stuff together. But there's a lot of facts here that I want to get out to you so that when you make your healthcare decisions for you and your family, you know, maybe you'll think twice about some of the things that that your medical doctor or some other physician might tell you to do. Okay? All right, let's start off with the down and dirty, the nitty-gritty. All right? JAMA, Journal of the American Medical Association. Okay? That is a subscription that you and I cannot subscribe to because they don't want you to know what they know between themselves. But anyway, we can still get the information. Came out with a study by a school you may have heard of, did the study, pretty popular school, Harvard, the number one medical school in the country. And what they found was every year people were dying from this strange condition called iatrogenic disease. Iatrogenic disease. All right, now what iatrogenic disease is doctor-induced. Okay? Actually, this was a study not just about iatrogenic disease, this was a study about iatrogenic death. Okay? What this study found was every year that approximately 180,000 people were dying from this iatrogenic disease. Now what that means was, it doesn't mean that, oh, the person had a heart attack, they went in, they did an 8-hour bypass on them and they didn't make it. It means that had they not done what their doctor told them to do, they would have lived. Okay? Here, take this medication, have this surgery, whatever. It was a complication of the medical intervention that resulted in their death. Okay? That's iatrogenic disease. 180,000 people, that sounds like a lot of people, but it's really hard to kind of put that in perspective. 180,000 people, you know, how many is that? If it was standing out here in a parking lot, maybe it'd make more sense. Of course, it would probably run all the way down Harris Boulevard. 180,000 people would be equivalent to 3 jumbo jet planes crashing every other day. Now think about that for a second. 3 jumbo jet planes, 3 big planes crashing every other day. Every other day. Now, would that make the news? Of course it would. Anybody ever heard this before? No. Why is that? Need 2 more chairs.
It happens all the time. So they're ashamed of it.
Well, but nobody knows. I mean, they don't want you to know this. If you knew this, wouldn't that make you, you know, think a little bit about the next time you went and had some sort of, you know, surgery or took some sort of medication? I mean, that's 108. That's 3 jumbo jet planes every other day. That's a lot of people dying.
Have you seen the latest figures?
Yeah. Don't get ahead of me now. Okay, now let's put this into another perspective. Every year, the CDC, which is the Center for Disease Control, you might want to pull them up here, yeah, so that people can still get out if, you know, there's an emergency. Okay, the Center for Disease Control every year ranks the causes of death in the United States. Okay? Anybody know what the #1 cause of death in the U.S. is? You know what it is. Just heart disease, that's right. #1 cause of death in the United States is heart disease. #2, anybody know? Closely related? Close. Stroke. These 2 are always the top, and they kind of flip-flop a little bit. And you already called out the 3rd one. The 4th one is kind of strange because they put all accidents in the same category. Not just car accidents, but falls or, you know, some sort of an injury at work. That's an accident. 4th leading cause of death. Okay, if you were to take iatrogenic disease and you were to put it somewhere in this list, anybody have any idea where it'd be?
#1.
Man, I'm going to put you in the back if you don't be quiet. Right there. Okay? That's where it would fall into on the JAMA study, Harvard University.
Spreading the cancer?
No, yes, it would be the 3rd leading cause of death in the United States. Okay? Now, when I didn't have a know-it-all in the class, I would have stopped there. But now, yes, as he said, the newest study. Originally it was 180,000, okay? Now the latest study, now what this combines is adverse drug reactions, medical errors, which actually, I got an article in this book, which y'all are going to start seeing this stuff. Did I get off camera? You're going to start seeing it. Look, this is family circle. This is at family circle you're starting to see this information. This one talks about, is your doctor hazardous to your health? In this one, it talks about 190, but that is just medical errors. 190, an average of 195 people in the United States die yearly as a result of in-hospital medical mistakes. That's just the medical mistakes. That's not the adverse drug reactions, the infections that are induced, the malnutrition, unnecessary procedures, surgery-related deaths. Okay, what the new number is, I'll tell you in a minute. The newest figure, 784,000. 784,000. Now, this information is put together by three medical doctors and 2 PhDs. Now, what they did was they didn't go out and they didn't do the research. What they did was they took the individual research already done on adverse drug reactions, on medical errors, on infections, on malnutrition. They just compiled it all together. It's already there. And when they compiled it together, this is the number they came up with. 784,000. Well, we're going to get to that too. 784,000 people. Now, 784,000 people, all right, if 180,000 people was equivalent to 3 jumbo jet planes crashing every other day, 784,000 people, 6 jumbo jet planes crashing every day.
For how long? Just
forever.
Every day?
Yeah, until people quit going to the medical doctor, I guess. 6 jumbo jet planes crashing every other day. I mean, that's unbelievable. I mean, that would make 9/11 look like a picnic.
Yeah.
I mean, 6 a day, that's crazy. So, now, this 784, now anybody know where iatrogenic disease fits in? Our primary form of health care right now in the United States is the #1 cause of death. It's killing more people than any of these other conditions. That's pretty scary to me. Yeah. So we tell you this because you need to be educated when you make decisions for you and your family when it comes to your health care, and whether you want to take a risk, because every time you take an aspirin, there is a risk. 17 side effects just in an aspirin. So you need to think about this number the next time somebody tells you to go take this medication like Vioxx. Okay? Yeah, if you took it 15 years ago, it could have killed you then, but you wouldn't have known about it until now, right? They first started noticing Vioxx was killing people 15 years ago. Why did it take that long to get it off the market?
It's still didn't advertise. See something advertised like Vioxx or something like that. Celebrex.
Well, Celebrex, yeah, and Bextra, those aren't going to be far behind, I don't believe, because they're very similar drugs. Yeah. But Vioxx, why is it taking off? Why did it take them 15 years? Because they made $15 billion in the meantime. Right. $15 billion they've made. It's the #1. It was the #1 advertised drug on the market, and that drug was bringing in $1 billion a year. That's a lot of money. And if they can postpone a little bad publicity, they're making $15 billion. Somebody's making rich off these people, off of this number right here. That's pretty bad. Okay. So, I want you to understand one thing, though. We're going to go a little bit further with this, but I'm not anti-medical, okay? What you have to understand is what their place is, though, okay? Now, that gets me to our next topic. We're talking about health care, okay? Yeah. Okay, now, how many people in here go to the doctor when they feel good? Very rarely, right? Most people go to the doctor when they have a symptom, when there are aches or pains, or they have a headache or a stomach problem or something like that, right? You go primarily when there is a disease process, some sort of symptom, some sort of disease care, okay? Actually, or some sort of crisis, okay? I'm in a crisis. I've got this problem, so I need to go have something done, right? All right. Well, this is where this makes up 95% of the health care in the United States, okay, cost-wise, etc. Now, that 95% of the health care is based primarily on crisis, or we'll say symptoms, okay, because you don't go to a doctor until you have a symptom, until you have an ache, a pain, a numbness, a tingling, a hot, a cold, some sort of symptom, right? All right, well, let's think about this symptom thing. Let's say you were to go out and buy a brand new car. I mean a real nice, I don't care what it is, a Mercedes or whatever you really like, okay? You were going to buy that car and you said, okay, for the next 10 years, I'm going to drive that car, okay? Somebody like me, I put 30,000 miles a year on a car, okay? I'm going to drive that car for the next 10 years, all right? I'm never going to get the oil changed, never going to have the wheels aligned, never going to have anybody look under the hood, never going to get it tuned up. I'm just going to drive and drive and drive and drive it until eventually it starts to fall apart, okay? Well, that's what we're doing with our bodies, is we drive and drive and drive until we have a symptom, right? We keep going and going and going. When there's a symptom, then what do? Okay, we're in crisis care. Now we can go to the doctor. Go to the, I mean, even here, you know, 99% of the people come here because they're in a crisis situation, because they're in pain or they have some other symptom. So if we base everything on this, let's say now you're driving that car down the road and all of a sudden the engine light comes on. Okay? Well, the engine light's on. What's wrong with it? Well, I don't really know, so you go to a specialist, somebody who knows. All right, let's say you pull up to the mechanic's office or a garage or whatever. Mechanic comes out and says, look, I've got a problem here. He looks at it and says, yeah, hold on just 1 second, I think I can fix it. He runs off, comes back, little spray paint, engine light's gone. Right? Engine light's gone. So what happens? You get in your car, you drive off, heading down the road. Eventually, what's going to happen? It's going to break down. It's going to fall apart. Somehow, something's going to break down, right? Well, what do you think you're doing when you take a Tylenol for a headache? Are you fixing that headache? What are you doing? You're temporarily covering it up, right? Do you really think that headache is coming from a Tylenol deficiency? No. I promise you, there's not a person in here suffering from a drug deficiency. So taking the medication is never going to fix it. It just masks the problem. Now, what's going to happen with the car? Okay, the car breaks down. You can trash it. Go get another car, right? What happens if your body breaks down? You can't go get another body. You can't trade it in. There's no 0% financing on it. Promise you. Okay, this is the only body you got. So you need to start thinking about things from a little different standpoint. If you wait till a crisis situation, perfect example. All right, there's a lot of examples, endless examples, but one that's very easy to explain and easy to understand, migraine headaches. Because I've got the research in those books that are on the coffee table. Migraine headaches. Anybody in here know somebody that has migraine headaches? Okay. Okay. 80%. 80%. Now that's 8 out of 10 people who have long-term migraine headaches will have a stroke. 8 out of 10. So your odds are pretty good. If you got migraines, you're going to have a stroke someday if you don't get something done about it. Okay? Now, how does that happen? Well, what's the mechanism of a migraine? Well, nerve supply to the blood vessels gets cut off, okay, at the brain stem. All right, we can explain that to you one-on-one. But what happens is the blood vessels are supposed to dilate, which means they're supposed to open up to allow more blood flow to the brain. And they constrict instead, or they don't open up fully, so you get a lack of blood supply to the brain. In turn, the brain gets hypoxic from lack of oxygen and you get a headache, you get a brain ache, basically, because it doesn't have enough oxygen to feed it, okay? Well, what happens if you cut off the blood supply to a part of the body long enough? That part of the body will die, okay? That's what happens when you have a stroke. You cut off the blood supply to part of the brain long enough, that part of the brain will die, okay? So by taking that Amitrex or taking that Excedrin migraine or that Tylenol migraine, what that does is it temporarily numbs the problem. You don't feel the pain, but you're postponing a further problem, eventually breaking down, okay? You keep spray painting over that engine light. Eventually, the car's going to break down. In this case, it would be the situation with a stroke. There are other problems, long-term digestive problems, can lead to diverticulitis and colitis and all the other kinds of itis. I mean, there's a lot of things going on that if you put them off long enough, eventually it's going to turn into a bigger problem. Okay? Another thing about symptoms. Symptoms are your friend. Okay? Now, you don't like to have symptoms, but be glad that you do. Let's say, for example, Dr. Mulvihill wants to take me out to eat one night. Okay? He's been doing so great in the office, and his numbers are up. He's making so much money, got a little extra in his pocket. He wants to take me out, so we decided we want to go to a Japanese restaurant. I use Japanese because it's the only place I know that there's a poisonous food that they serve. We go there, and Dr. Mulvihill gets the bright idea. He wants the blowfish. He always gets the blowfish. Well, tonight, the blowfish cutter is on vacation, so they brought in the dishwasher today. He's cutting the blowfish. Well, he doesn't have a lot of experience with the blowfish. So anyway, bottom line is we eat the blowfish. This is the best blowfish we ever had. Never had blowfish. But anyway, we go our separate ways. He goes home, I go home. Well, all of a sudden I wake up in the middle of the night. All of a sudden I get this back of the throat feeling. Start getting achy. I got a headache, feeling feverish. All of a sudden I got this right at the back of the throat. I'm up. Where am I? I'm headed for the porcelain god. Okay? All right, I'm throwing up. All right, I got chills. I'm feeling horrible. All of a sudden, my lower bowels start to rumble. I got the porcelain god. I don't know whether to stick my head in it or sit on it. I'm getting sick, okay? Well, all right, I'm puking. I've got diarrhea. I'm feeling really, really bad, okay? Finally, I get all that out of my system. I crawl back up to the bed, climb up into bed, boom, I'm out. Well, I wake up the next morning, call over Dr. Mulvihill's house. Somebody answers the phone. Hello, is Dr. Mulvihill there? Who's this? This is Dr. Drury. Is this the same Dr. Drury that went out and had blowfish the other night with Dr. Mulvihill? Maybe. Why? Well, Dr. Mulvihill didn't make it. That blowfish was poisonous. He didn't make it. Sorry about that, Doc. So, let's say the Sandman medical doctor is roaming around that night, okay? Sandman medical doctor comes by my house, okay? What's going on, Doc? Oh, feeling horrible. I got a headache. I got chills. I got fever. I'm throwing up, diarrhea, muscle aches. Well, hold on. Let's see. Here, give you a little bit of this. Take this for the vomiting. Take this for the diarrhea. Clog you up at both ends. Take this for the muscle ache. Take a little bit of this for the headache. And take a couple of these that'll knock you right out. Okay? I take all that stuff. Crawl back into bed. Feeling better. But where am I at the next day?
Dead.
I'm next to Dr. Mulvihill on the slab, right? Okay? Now, Sandman medical doctor goes roaming by Dr. Mulvihill's house. Looks in the window, sleeping like a baby. Must be doing great. Okay? He's gone. Doesn't help Dr. Mulvihill at all because he's on the slab with me the next day. All right, the Sandman upper cervical doctor. Now, for those of you that aren't patients, we have a little machine that we can test and see if you need to be adjusted or not. All right? Sandman upper cervical doctor comes roaming around, comes by my house. What's up, doc? Oh, feeling horrible. Well, hold on, let me check you. Run the meter up the neck. Everything looks good. No interference. Body's talking to the brain, or brain's talking to the body. Body's doing everything it can to save you right now. Well, it doesn't make me feel any better, but hey, I'm gonna wake up in the morning. Sandman upper cervical doctor comes by Dr. Mulvihill's house. He doesn't care how he's feeling. He walks in, bends him over, rolls the meter up his neck. Whoa, we got a little interference here between the brain and the body. Emergency situation, toilet seat works pretty good. Lay him over on the toilet seat, boom, open that nerve supply up from the brain to the body. All of a sudden, the body starts screaming to the brain, whoa, we got something, we got to get out of here. Kick in the gag reflex, start those bowels churning. Things are going out every orifice, but Dr. Mulvihill wakes up the next day. Does that make sense? So symptoms are a good thing. They're there to save us. When you put your hand on a hot stove, be glad that you have that symptom before your olfactory or your smelling starts kicking in. Make sense? It's there to protect you. When you take a medication to cover up these symptoms, it's like waking up at 3 o'clock in the morning, your fire alarm's going off. So what do? Get up, walk out there, jerk the battery out, go back to bed? Of course not. Well, that's what you're doing when you're covering up these symptoms. Do I need to go on about symptoms? Okay. All right, good. Okay, so now back over here to this healthcare. So the other problem with this whole symptom situation is very, very expensive. All right? This is why the United States has a major healthcare crisis because, the drugs now are what? Some of them are $10 a pill. Okay? It gets very, very expensive. And then the insurance companies, they up their premiums, and then it just starts it starts to snowball. So, first of all, this system is the #1 cause of death in the United States. It bases everything on symptoms which are there to actually protect you. And it's very, very, very expensive. Okay? Now, so let's talk about what really healthcare is. Okay? So first, let's talk about the health part. Okay? All right, real quickly, I'm going to write a couple things down here that we all need to sustain life. Okay? Let's see. Food, water, air, and then nerve energy, which I will explain in just a minute. Okay, food. How long can you live without food? Anybody know?
Days and days and days. Long time.
Yeah. Me about 4 hours, but they say without dying, they say you can go about 30 days. Okay? Yeah, you won't be very comfortable, believe me, but you can survive. Water, anybody know?
Not very long.
3 days, I think, before you start to have brain damage. But I think you can actually live about 7 days without, I mean, you'll be in a coma probably after 4 days. But, okay, without air, yeah, basically about 4 minutes without, I think about 3 minutes, again, you start to get some brain damage and stuff. All right, nerve energy, okay, and I'm going to explain this to you, so I'll just go ahead and tell you. You can't live 1/1,000,000th of a millisecond. All right, without nerve energy. Now, nerve energy is a broad term. Well, in the chiropractic profession, we refer to this nerve energy as innate intelligence. Okay, now innate intelligence. Innate means inborn. This is the intelligence you were born with. It's the intelligence that took you from 2 cells and turned you into this incredible being that you are. Okay? It is what animates all living things. Without innate intelligence, there is no life. Okay? It is perfect. It is what we refer to in this office as God. Now, this innate intelligence is it's not like something that just kind of is travels throughout. It's not inanimate. It actually travels via the nerve system. Okay, this is the intelligence that God instilled in you to keep you healthy, to heal. Okay, when you cut your hand, you don't have to do anything to it. That innate intelligence that you were born with will actually come in here and it knows what to do in order to heal that wound. Make sense? Same thing happens with every other part of your body, every cell in your system. Okay? Now, this innate intelligence is what we base everything we do on. Okay? So, if this is what upper cervical care is based upon, and since upper cervical is not a philosophy, it's not a theory, it's a science, then we have to be able to prove this. So how do you prove innate intelligence? How do you prove God? A lot of people used to say, you can't. Okay. Well, it's very simple, actually. Peanut butter and jelly sandwich is all you need. Okay? All you do, first of all, you make your sandwich, right? Then you take a bite, chew it, swallow. Okay? Then what? Okay? But what do you do?
Thirsty.
All right. Okay. No. All right. Now your esophagus starts to push it down into the stomach, right? Okay. Well, in there you've got carbohydrates, you've got fats, you've got proteins. Okay, all of those have to be broken down. Okay, so that means you need hydrochloric acid, you need bile, you need your pepsid. Yeah, all those you need. So are you sitting there going, okay, let's see, we need 0.3 milliliters of hydrochloric acid, we need 4.7 liters of pepsin. We've got to break down these carbohydrates. Then it goes down through the pyloric valve into the small intestine. Now in there you've got minerals and vitamins along with the carbohydrates, proteins, and fats. Now, when it gets in there, that's where most of your absorption takes place, in the small intestine. So at this point, you're thinking, okay, now my left pinky toe, there's a cell there that needs a little extra fat in the wall, so let's send that down there. Obviously, all these things are happening, you don't think about it, right? Okay. That's not controlled by you. You don't have to think about it. Obviously, there's something, a higher power that's taking care of this, okay, that's running all of these individual processes. Now, that's just one example. Let's take this thing a little further. All right, everybody is made up of approximately 17 trillion cells. That's a lot of cells. That's an average, okay? Let's start 75,000, 75 million, 75 billion, 75 trillion. That's a lot of zeros, okay? That's approximately how many cells make up your body. Now, at any one moment, and a moment isn't a measurement of time, okay? A moment is an instant in time. At any one moment, there's approximately 200 chemical reactions going on in each of these cells. 200 chemical reactions. That's pretty phenomenal. First of all, it's pretty phenomenal. We made up of 75 trillion cells. That's a lot of cells. But then when you figure in each one of these cells, there's approximately 200 chemical reactions in a moment. 200 chemical reactions in each of those cells. All right? So how much is that? 150 50 gazillion or something. That's a whole lot of chemical reactions, okay? That's how many chemical reactions are going on in a moment. How many chemical reactions now are going on in a second? How many chemical reactions in a minute? In an hour? In a day? Y'all see where we're going here? We're approaching a number that we can't comprehend. Okay? The nth degree, right. We're approaching infinity. Okay? Now that's pretty cool. But what puts this all together is there's organization here. Every one of these chemical reactions takes place for a purpose. There's a reason behind it. Okay? So if there's organization, there's got to be intelligence. Anybody ever seen a house just build itself? It doesn't work like that, right? There's got to be intelligence behind it. So if it's organized, there's got to be intelligence. So what we're looking at, what else could possibly be infinitely intelligent? And don't everybody scream out, Dr. Drury. It hasn't happened yet, but I keep waiting. All right, what else could possibly be infinitely intelligent? Exactly. I've actually had ministers ask me if they could use this. I haven't actually sat in and see if they did. But that's pretty cool, isn't it? I've gone through this 100 times, but still, sitting here right now, I swear to Him that I got chills going down my spine because, this is what we're dealing with, and this is what makes us so infinitely powerful. That's why when somebody comes in here with South African dripping diabetes, no, I'm not going to say, no, we can't help you, because when we're dealing with this type of intelligence, we don't know until we get in there and we open up this innate intelligence that you were born with and allow your body the opportunity to heal itself. When we open up the communication between God and your body, then we don't know what our limitations are. The only limitations that we've discovered are
our own limitations.
Matter. Yeah, limitations of matter. If you come over here and you cut your arm off and you lay it over there on the table, no, I can't adjust you enough times to grow out another arm. Okay? And I'll explain that a little bit further, but that's what our limitations are. Okay? Does this make sense? Is this kind of cool? Okay. So, when we're dealing with this power of innate intelligence, it's pretty awesome because because when we recommunicate the brain to the body and God to the body, then a lot of cool stuff can happen. All right. So now let's get back to this thing called health. What is health then? All right, we're dealing with this innate intelligence. So health is, that red seems to write pretty good. Health is let's do it like this. Health equals a 100% expression of this innate intelligence. Okay? That's what health is. It's a 100% expression. If you can express this innate intelligence throughout your whole body, then you will be completely healthy. Okay? So, what then would be a 0% expression of innate intelligence? Exactly. Very good. Okay? Now the problem is most of us are somewhere between here and here. Okay? Now, how do you go from here to here? Well, there's several things. If you leave here tonight and you're driving down 85 and all of a sudden you flip your car over and you're rolling down the interstate and you cut off a leg and you sever a major artery and you got an eyeball hanging out, that's probably going to pull you down here a little bit. Okay? Now, if that happens, don't call me. Okay? That's where we go over here to the crisis situation. Okay? Now, that's where I'm a big fan of medicine. We got, fortunately, the best system in the world under crisis care. Okay? When it's an accident or when it's a crisis situation, a real crisis situation, they're the best in the world. Okay? So that's where you want to go. But that would bring you down here. Now, there are other things that can bring you down a little bit. You know, if you're, if you've been smoking for 40 years, that's going to lower your health potential, your expression of that innate intelligence. If you're on a lot of medications, when they're trying to bring you up here, they're actually pushing you further down because they're running interference with that expression of innate intelligence. So there's a lot of things that can pull you down from 100% on down lower. Okay. Now, the one thing that I want to talk about tonight is what we specialize in. And that is, well, hold on a second. My mouth moves faster than my arm or my hand. That stuff doesn't come off very good. Is that thing leaning down? What is doing?
That's great. What you did, that's great.
Ah. Now I'm crooked again, aren't I?
That's good enough.
Well, it'll drive. I'm anal. It'll drive me crazy.
They gotta move it. Yeah.
Okay. All right. Okay. What we're talking about here that can interfere with that expression of innate intelligence is something that's called a subluxation. It's a big fancy word. Basically, what happens is it interferes with the expression of innate intelligence. Now, normally what I would do is pass these rubber bands around to everybody, but since we got started a little bit late and we've got a pretty big group, what I'm going to do is I'm going to take the abuse myself for you guys, okay? I'm going to sacrifice. What you would do is you would take this rubber band, twist it around, turn it a few times, wrap it around your finger, all right? And then, let's say you couldn't see this rubber band, okay? But all of a sudden now you started to have some symptoms, okay? First thing I notice is it starts to feel a little bit funny, maybe some numbness, tingling, something like that. Eventually it's going to start to hurt a little bit. So where do I go? My medical doctor, okay? They can't see the rubber band either. But, you know, finger's starting to hurt a little bit. So first thing they probably do is give me some sort of oral pain reliever or something, you know, some Tylenol or ibuprofen or something like that, okay? Well, that doesn't really do the trick. So then you go back, and then what's the next thing? Usually they like to give you a little cortisone shot or something, you know, kill the nerve ending, so the problem's still there, but you just can't feel it. Well, then you start to notice that now it's starting to kind of turn colors a little bit. So you go in and say, look, you know, and well, they go, well, there's got to be something going on here with the circulation. Let's give you some sort of vasodilator or something, you know, increase your blood flow, you know, open up the blood vessels a little bit. Of course, that ain't going to work. So then they say, well, let's see, last step is surgery. So let's maybe do a little bypass here. Let's cut this artery in this vein and this artery in this vein and, you know, try to reconnect them around here and see if maybe we can get some blood flowing. Well, if you leave this rubber band on here long enough, what's going to happen?
Fall off.
Exactly. And if you don't believe me, I can take you back where I grew up in Kentucky and you learn how they turn bulls into steers.
Oh, yeah.
You leave a rubber band on a body part long enough, it'll fall off. I promise you. Okay? Well, that's what happens with a subluxation. Okay? That's when one of these bones in the upper part of the neck gets misaligned. Subluxation has to do with something that's called pressure atrophy. Okay? If you put pressure on a part of the body long enough, it'll actually die. Okay? Now, where does this subluxation take place? There's only one of two places in the body, and it's one of these top two bones. Let's see if I can draw this because I failed out of art school, so I went to chiropractic school. It's like me, he got a really large brain, so he needs a lot of space up here. Okay, there's the brain stem, and then from here down it's spinal cord. What's so funny? Okay, now I'm just doing a little cross section here of these bones. Okay, now here's the brain, here's this brain stem, here's the spinal cord. Now what happens is the mental impulse leaves, let's change color so we can make it a little more interesting. It starts off here somewhere at 100%, okay? Then it travels down the brain, through the brain stem, and then it comes out to your heart, your liver, your lungs, your kidneys, your arms, your legs, anywhere in your entire body. Let's use something that's kind of an easy example. Let's say the pancreas down here. Okay, this is the pancreas. It's a good-looking pancreas. All right? Now, it starts at 100%. Goes down here, it winds up at 100%. So what happens? Pancreas works at 100%, right? Now, let's say that you had some sort of an accident, a trauma, a fall, an auto accident, an injury, abuse, something happened, and it pulled this bone over here to the brainstem to where it actually leans up against that nerve, or the nerve pathway there going through the brainstem. Well, it starts at 100%. Now, all of a sudden, like stepping on a garden hose, it gets diminished going through there, and it comes down to the pancreas at about 80% or 90%. What happens then? Well, the pancreas doesn't produce the proper insulin, right? Well, this keeps happening, and it keeps going on. It keeps getting worse and worse. Now, all of a sudden, it's down to 50%. So you get 50% of the production. This can go on until you get down to 0. It can fluctuate. So this is just this is what can happen with the pancreas. All right, it's kind of like somebody took this rubber band and put it right here around that brainstem, and it's cutting off the nerve supply from your brain to that part of the body. Now, let's say it's coming down here, and this is your heart. Okay. Y'all liking my drawing? Is that what? I mean, that's a heart, isn't it? Surely you can figure that one out. Okay. All right. So now it's being pressed upon here. So now your heart's only working at 90%. Well, 90% for my heart ain't good enough. Okay. It shouldn't be good enough for you either. Okay. So then it gets down to 70% or 60%. What does a heart attack feel like before it happens? Well, right before it happens, but I'm talking about leading up to it. This normally starts about 10 years before you ever have a heart attack. Yeah, but I'm talking about, typically how many times have you heard, oh, he walked off the 18th hole healthy as a horse, and boom, his heart stopped. What about the guy Jim Fixx? I'm sure you guys have heard of, wrote the Run for Health book. He ran every single day for 20 years. He wrote books about it. How could you be much healthier than that? And the guy all of a sudden running down the street one day had a heart attack. Now, how healthy was his heart? He wrote books about it. Okay, obviously, there's a lot more than just body fat that determines how healthy you are. Okay, it comes from your nerve system. Now, this could be coming down here to the kidney. It could be going to your stomach. It could be down here, you're going down your legs, sciatic problems. It could be anywhere in the entire body. Everything goes right through this one area. And if you put a rubber band around it and you cut off or you diminish the nerve supply to that part of the body, it's going to start to malfunction. That's just the law. Okay? It has to. All right. Does this make sense? Mm-hmm. So can you see now how you can help people with diabetes? How we can help people with kidney problems? How you can help people with digestive problems? Okay? Now let's move up a little bit, because a lot of times people have a hard time understanding this. And I just want to make it very easy for you to understand. Now, I'm going to make a little bigger head this time. No comments from the peanut gallery. Ooh, a little Cro-Magnon man going there. I don't know what it is about me and the forehead. I always get a really big forehead. All right, that's close enough. Okay. Now, up here again, you've got the brain, okay, the brain stem. Now, what happens in the brain, okay? The brain, you have to realize, is just like an organ. It's innervated by innate intelligence, okay? The liver has a purpose. The kidney has a purpose. The stomach has a purpose. The brain has a purpose. Its purpose is thought processes, conscious awareness, memory, emotions, okay? Now, what happens is people think that when something happens in the brain, it's like a spark that goes off, like you see the cartoon, the light bulb went off, the thing, Well, actually what happens is it starts in one part of the brain, then it travels to the brainstem. This is in any neuroanatomy book, okay? Travels to the brainstem. The brainstem directs it to the part of the brain that is to interpret that message. So it starts somewhere over here. Okay, travels to the brainstem. Brainstem, like the switchboard operator, sends the message, connects it over here where it's supposed to interpret it. All right, so as long as this message is not interfered with, then everything's cool. Memory, thought, learning, emotions, everything's good. Now, one of these bones here, though, gets misaligned and comes in here, and now all of a sudden it's putting pressure on this message, or on the pathway there. Now all of a sudden you've got 80%, okay, or 70, or 60, or 50. Anything less than 100% could lead to what?
Death.
Death is one example. Depression, anxiety, panic attacks, learning disabilities. Does that make sense?
Yeah.
Emotional problems. I mean, all of these things. B.J. Palmer, the guy who founded this upper cervical procedure, did 16 years of research on it. He took from the psychiatric ward in Davenport, Iowa, he took all of their failures and still got 50% of them better at from the psychiatric hospital. BJ used to say if you could go into the jails and start adjusting people, that you could turn lives around just like that. Because of how many people have abused themselves with drugs, physical abuse, that have turned around. Have you ever seen somebody who's been in an accident and all of a sudden their personality changed like that? Man, it happens all the time. The reverse happens in here all the time. The girls will be talking about some patient, in our huddle, not in front of other people. But, like somebody came in, man, when they first came in, man, they were really grouchy and they were really, really mean and blah, 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 And since they started getting adjusted, all of a sudden they come in, man, they're just the sweetest people in the world. And that happens all the time. And it happens right here. Sleeping problems, all the things that you would associate with something going on up in the head can happen right there. Does that make sense? Okay, so next time somebody says, we have people come from all over the place. As far away as Canada and Mexico and everywhere in between. So next time somebody says, well, why are you driving all the way over there to see that chiropractor when there's one right down the road from us? Okay, what you do is you take out your little rubber band, which I should have given you, and you just put it right around their head and say, well, let's see how long you can go with that rubber band around your neck. Okay? All right, so the subluxation. Now, does this make sense? This is where we're talking about the health care. Okay? Now, the health part is the expression of innate intelligence. Caring for your health is making sure that you have that 100% expression of innate intelligence. This is the only way to do it. Now, yeah, there are other accidents and there are other things that can lower your expression, but this is the number one reason people lose that expression with their innate intelligence. That's the number one reason why. This is the number one, the biggest healthcare problem on the planet today. To give you an idea, Dr. Anthony Dobbs was a researcher. He found that at Boston University, he found a 100% correlation with a misalignment in the first bone in the neck. Could have been either bone, but in this situation it was the first bone, and SIDS. 100%. They dissected 2,000 babies that had died from SIDS, and not one of them did not have, and this is a medical doctor, not one of them did not have a misalignment with the first bone in the neck. Respiratory center resides in the heart of the brainstem. Okay? Think about, remember when they used to have babies sleep on their stomach? Why now do they have them sleep on their back? Well, they just say because less kids die. But why is that? Well, if that bone's already turned and rotated and misaligned, and then you take that head that much further, and then you lay them on their stomach, then boom, that just wrenches that respiratory center that much more. Literally cuts off the message from the brain to the lungs. Baby just lays there and the message to breathe stops. So the lungs quit working. Does that make sense? Okay. That was Anthony Dobbs. And then Dr. Gutmann, which is a German medical doctor, he found normal bursts. After researching, this is a medical doctor in Germany, which Germany has one of the best medical systems in the world, by far. By the United States, 24th in the country. 24th in the world, okay? All of our multi-billion-dollar industry, 24th we rank in the world in overall health and life expectancy. That's pitiful. And think how much money we're paying for it. These countries that have socialized medicine that don't pay anything for it are ranked 1, 2, probably the top 12 are all socialized.
Well, where do we rank in pharmaceuticals?
Oh, now I'll get to that. Okay, Dr. Gutmann. Dr. Gutmann was a German medical doctor. He found that 75% of all normal births had a subluxation at the upper part of the neck. One of the top 2 bones in the neck, 75%. Okay, that's normal births. But you think about it, the kid's riding upside down in this little hole in the pelvis, and then all of a sudden, these muscles are squeezing him, trying to get him out, like pushing him through I can't come up with an analogy, but, a little opening. 75% are born with a subluxation, okay? By the time the average person is 45, 95% of people 45 years old and older have a subluxation going on at the upper part of their neck, okay? That's most people. The problem is only about 10% are under care, and probably only 1% are under upper cervical care, which means there's 94% walking around in the United States today, well, in the world, that need to be adjusted that aren't, that have their innate expression, innate intelligence is cut off from the brain of their body, causing their body to go into a state of dis-ease or sickness. So that's why we need you guys. Now, let me talk for... I need to do this thing on retracing real quick. Most people have never really been through a healing process. So most people have never gone through retracing. Now, retracing is very important. Let me explain it. At one time in your life, it may have been shortly before you were born, or it may have been last week, probably more closer towards when you were born. You're at 100% health, okay? Well, things have happened to you. Starts off usually with some sort of a trauma, and it usually, especially early in life, additional traumas, falls, accidents, usually starts off with some sort of stress, okay? It's a physical stress, a chemical stress, or emotional stress. But it usually starts with the trauma, and then the other stresses start to add in. Things have caused your health to kind of diminish a little bit going through life. Little stresses, okay? The delivery process possibly, or let's say you're in that top 25% that made it all the way through the birth canal without a subluxation, okay? Well, then you roll off the changing table, or you fall off the bed, or roll down the stairs, or hit your head on the coffee table. You know, there's endless ways that this can happen. So your health gradually starts to diminish over time, all right? Sports injuries, playing, cheerleading, football, wrestling with your brother, all these different things, slipping and falling on the ice. Then you get a little bit older, you have auto accidents, stress such as work, girlfriend, boyfriend, school, all these things start to add up over time. And as that happens, it brings your health down to get you to the point where you are right now. Now, along the way, what's happened is maybe you have a little, your immune system went down a little bit. That's usually a pretty good response. Kids with ear infections, colic, they start to get colds, flus frequently, stuff like that, okay? Then a little bit further along, okay, you start to get headaches, not every day, but, every time you get a little stress, you start to get that tension headache. Well, a little bit further along, now you start to get some neck pain that goes along with those headaches. All right, then... a little bit further along in high school, you start to develop some sleeping problems because you blame it on staying up through school, drinking coffee, studying for that test. But then you get to where you just can't sleep good. Then you start to have a little reflux or a little heartburn. Or then by the time you get in here, okay, you got some lower back stuff. Now it's going down your leg. Whatever the symptom may be, okay, gradually over time these things start to develop. Now where they come from, let's look over here, and I'm going to try to draw my rendition of an atlas, or the first bone. Okay, that would be a bone. Okay, now inside this, you have something called the brainstem. This is a cut section. Okay, now that brainstem fits right inside of that opening. Now what happens is some sort of trauma, some sort of an accident, some sort of an injury started, it went, let's say it went this way, causing some pressure right over here, okay? Now, going through this brainstem, you've got, remember those 75 trillion cells? Every one of those has this communication to the brain. Every single cell is like a little person. It's connected to that brain, and it has all the same functions that a person would. It consumes, it excretes, it replicates, all these things. So you got all these pathways going through here. Okay? Now, when this bone slid over here up against that brainstem, sometimes that can cause a problem. Okay? Almost directly, especially if it's after a severe injury or an accident. But a lot of times what happens is that brainstem, it sits in there. Okay? But it doesn't just sit there. When you turn your head and you move around and you do things, that brainstem slides. Okay, in and out of that opening there, the brainstem. So if that bone has gone over here, now all of a sudden it's doing this. Okay, well if you do this to yourself for 5 or 10 minutes, it's probably not going to faze you. You do it for 5 or 10 years, it's going to start to cause some problems. Well, what happens is as that brainstem slides up and down through there, what it does is it lays down callus formation inside between the brainstem and those pathways. So what does the callus formation do? Well, it decreases the amount of space in here and actually increases the internal pressure. So the longer this stays here, the more pathways it's going to affect because it's going to cause more and more damage as it does that. Does that make sense? So as it does, it's going to start hitting on some of these other pathways. Okay, it started off, it just started hitting the immune system. Okay, your overall function of the nerve system is what affects your immune system. The better your nerve system works, the higher immune function you'll have. Okay, but then, it's affecting the nerves going up around the back of the neck, the suboccipital area, whatever, causing headaches. Then it starts to cause the neck starts to compensate, because when that bone misaligned, your body compensated. Okay? Then it's affecting the nerve pathways to the sleep centers and shutting your brain down, is having a difficult problem. Now it's affecting the nerves that come down here to the stomach, causing you to produce the wrong amount of hydrochloric acid, or in response to food, or your gallbladder doesn't work. There's several different reasons you could have reflux. Then your body's compensated all the way down to the lower back. It's got your pelvis twisted. It's got your weight out of unevenly distributed, causing more pressure on one side than the other, resulting in lower back problems. So all these things have resulted from this one little fall or trauma, and then these additional falls and traumas that have happened over time and stresses that have hit you. So when we come up here and we adjust this bone and we bring the bone back out here, now let's say this is the outer edge, and so there's no pressure there. So now what happens is you start back up this way, because the last pathway that's affected here, now the pressure is going to be relieved, so it's going to heal this way. So the last one affected will be the first one to clear up. Does that make sense? So you might go through, now you may have been sleeping like a baby for the last 5 years. Now all of a sudden we start adjusting you, and then you come in here and say, man, doc, my back's better, no problems with the legs, my reflux is cleared up, but now you took away my sleep. But no, actually, we did take away your sleep, and now you'll know why you lost your sleep. Now, hopefully you won't. But if you do go through some of these symptoms, I've got people right now in their 60s that are retracing things. Yeah, doc, man, I had this problem when I fell off that wagon. I think I was 12 years old, so I started having that problem then. So I'm already back to 12 years old. They literally can trace back as their body heals. They've been through so many problems that they finally got to 12 years old, and they're excited about it. So as your body heals, expect some of this retracing. Sometimes problems might get worse, and then they'll get better. Okay? So you're going to come back this way, trying to get back to this 100% health. That's where we want to go. Make sense? Okay. Any questions on retracing? Okay, good. Okay, so now that we've done that, now we can get into the good stuff.